People try to look at good and bad in terms of these nutrients, and in nutrition, it's not that. Like, it's a spectrum that you have to decide what's appropriate for the patient in front of me.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
This is the Purr Podcast. My name is Dr. Jolle Kirpensteijn. I said that already. And
you did.
Who do we have the honor with?
I'm Dr. Katie Tolbert. It's
Yay!
nice to be here.
She's back.
Yeah.
She's back.
I know. So we should make a note that we're recording this at the Western Vet Conference.
As a matter of fact, when this goes live, we have recorded it like a day before.
So it's breaking news.
Breaking news. So
No pressure.
Oh, no.
the hottest stuff in veterinary medicine is happening right here, right now.
Yeah, in a hotel room in Las Vegas.
Right.
Perfect. As it should be.
I love it. I
As
love it.
should be. I'm Dr. Katie Tolbert. I'm an associate professor in the gastrointestinal laboratory at Texas A&M University, and I'm a board-certified small animal internist and nutritionist.
That's awesome. We had Jörg not that long ago.
We did.
Oh,
Mhm.
okay.
Yeah.
We did. Yeah.
My boss.
And
your
are you
boss-
from Lexington, Kentucky?
That's where I was born. I grew up in Georgia, but I was born in Lexington.
You don't sound
Really?
South, really.
No, I don't
Why
have
is
an
that, do you
accent.
think?
My parents didn't have an accent, so I think
Are they from the South too, or?
they are.
Transplants?
Yes, they were from
Yeah.
the South, and they just
Yeah,
didn't have an accent.
yeah.
I guess I grew up close to a big city, so not many people have an accent.
Yeah. Once you have like bigger populations, everything kind of
Exactly.
neutralizes
Exactly.
out somehow, doesn't it?
Yes.
So
Yeah.
you are double boarded.
Correct. Recently.
I just want to say, because I remember it,
Yes.
I was at ACPM when you got your
Yes,
diploma.
my
I
certificate.
was like applauding in the audience, but
Yeah.
so you got punished once. Why did you want?
Why
to
would you
be-
do it again?
It's a fair question. I spent a lot of time trying to become what doesn't really exist, but we kind of call a gastroenterologist in veterinary medicine. And as I was doing more research in clinics in the area of gastroenterology, really realized that nutrition is the mainstay of therapy for most of our acute and chronic GI diseases. And so I needed to learn more about nutrition. And nutrition is a really hard thing to learn about on your own. So I had the benefit with the GI lab support of doing an alternate track residency in nutrition. to
That
learn
is
more.
so cool.
Yeah.
And then you have to do an exam, I guess.
And I had to do an exam.
Oh my gosh.
Yes,
That
it was
would be my
not
favorite
pleasant.
part.
It was not. I barely passed, but it's fine.
I think nutrition is complicated.
It is complicated.
I'd rather tackle like the pancreas, and that says a lot if I want to tackle
It is complicated when you first kind of get into it, but honestly, I think we as nutritionists could do a better job explaining it in a way that's more digestible and understandable. And I think then people would see it as actually this is something that I can do.
Mm.
So
Yeah, I think across disciplines, it's always good to be thinking, can I deliver this information like clearer, easier? Yeah. I was just talking to somebody earlier today about how the way we deliver information to whether it's veterinarians or whoever, right, that is changing over time.
that's
Like
right.
People's
Big time.
the ways they expect to learn are different.
Exactly.
Yeah.
Yes. It is a real challenge, isn't it, as you get older? And then there's this generation that comes up and they have a different way of learning and wanting to develop it. So you have to sort of be open and adaptable to that.
Absolutely.
So what's new in cats and nutrition?
Ooh.
Man, I mean, what is new in terms of, I will say what's old and new. You mentioned pancreatitis, and I think that's something as nutritionists, gastroenterologists, that's probably where we need to head in terms of an area of research, an area of kind of clinical understanding is we don't really know what to do with feline pancreatitis.
I think the
nutritionally.
pancreas is like a black box.
Yes, it's true. And it's really unfortunate because it's such a prevalent condition. And at the moment, we're sort of like, you treat it like inflammatory bowel disease. And I'm actually not sure that that is entirely correct. And we certainly know that feline pancreatitis is very different, especially nutritionally speaking, from canine pancreatitis.
Sure.
So I think that's an area
They're
where
different beasts.
many companies need to invest in the research to better understand this disease and how.
Wouldn't that be lovely, though?
Yes.
Yeah.
We're always ready to help.
Yeah.
Well, but for as far as like the big nutrition companies go, kind of the low hanging fruit is gone, right? Like the kidney diets,
yes, that's
and
true.
right, and so they are moving into areas that are a bit more complicated. They're multi diseases.
That's right.
It'd be really nice to see somebody tackle, especially chronic pancreatitis in cats, right?
Mm-hmm.
Yeah, but of course we have to start understanding it first.
That's right. And it's funny because a lot of the research that goes into feline pancreatitis is so, from a nutrition perspective, is really, really, really old.
Yeah.
So we need to understand if those same rules still apply, or if we should be tackling it in a different way.
Well, I would think like we're not doing a stellar job.
Yes. Yes.
The way it is right now. So so it'd be really nice. When I say things like that about pancreatitis, because I really don't understand pancreatitis, I feel a little ungrateful, because look at how many advances there have been in feline medicine just in the past few years, right? Like the new diabetes drugs.
It's true.
And we can treat FIP.
HCM.
All this like rapidly evolving HCM.
It's true. It is true. Like many of the pharmaceutical companies are starting to understand that there are many cats in this world and many people who want to give them the best medicine possible. And so, the people are stepping up.
Yeah.
The cats are the fastest growing population of pets.
That doesn't surprise me.
So people are getting more cats.
Yeah.
Why do you think that is? It's always hard to understand trends, obviously, and it's not one thing.
I think the two big trends that we see is smaller dogs and cats.
Yeah, okay.
That are increasing. And probably it's easier.
Easier.
Right.
Yeah.
And
easier in many ways,
there's a lot of people living in urban environments, and it's much easier to have a cat when you live in a flat.
That's true. Yeah.
You see it in Asia, that's happening, where everybody's living in these huge flat blocks.
Yeah.
And you don't have to take your cat out.
Yeah.
Because you have this unique combination of internal medicine and nutrition. So if you look at chronic pancreatitis in cats, what would you like to have?
Oh yeah, if you could design a project, what would you do?
If you could say, hey, now I have a more important, I'm going to design a new therapy, including nutrition, what would it be?
I think it would probably follow on some of the earlier studies that would suggest that cats, instead of, as compared to dogs, the protein source and the protein amount might be really, really important for feline pancreatitis. There's an earlier study that would suggest that intact protein may be somewhat upsetting to the feline pancreas, but that's based on very limited work with very small studies. So it would be one of the first studies that I would do is just compare.
It's counterintuitive.
Yeah, they seem to do better with hydrolysates, which is different from what is thought about with dogs.
But would people do it?
I don't know.
Because people get chronic pancreatitis.
Yeah.
I wonder what it's like. Yeah.
So
I think it has to do with the enzymes then that break down protein?
Probably, I mean, it's probably something about enzymatic release and exactly.
So it's easier.
Yeah.
Maybe to, I don't know.
Well, it's hard to tease out like the component of the inflammatory bowel disease that they often have an association with that. So it's difficult, isn't it, to take a cat that just has pancreatitis.
Right. Because I think they almost don't exist.
Yes.
Or at least, I think they may be mainly chronic pancreatitis, but they have a little bit of IBD.
And it's so hard to prove that their intestines are normal.
Yeah.
We know that's complicated. Yes, exactly.
Obviously, the microbiome has something to do with
it. Well, I was wondering how long it would take for microbiome to slip in there.
Yes, sure.
But okay, so a hydrolyzed diet, some way, what else?
Where else would you go with that?
With feline pancreatitis, I think. I think doing some of the investigation of like the fat composition. What's the influence of omega-3 versus omega-6 fatty acids? Like, what stimulates the pancreas less? It's my feeling that like fat is not a big of a deal in feline pancreatitis, and actually I think we overhype it in canine pancreatitis as well. But I think some of the low-hanging fruit really is to look at EPA DHA supplementation in cats with feline pancreatitis, and look just simply following things like their FPLI or ultrasounds, et cetera, to see if it results in any improvement. But the hard thing, as you guys know, is like generally speaking with nutrition, not one thing is going to be the answer. It's
Right.
usually multifactorial, where you have to have this and a little bit of this and a little bit of that. So I think that's the challenging thing. The thing that scientists don't really like is actually with nutrition, you do need to kind of combine prebiotic fibers and fish oil and maybe a hydrolyzed protein and see a benefit. But if you do one of those single things, maybe by itself, it's not going to result in any improvement.
Yeah.
So it makes it hard, because you'd almost want just like a clinical study where it's like, we're going to do all the things and see if they get better. And we're not going to be able to explain why they got better, but the combination probably improved them.
Yeah, but we have other nutrition studies that are like that, right? Like we look at diets for cats with chronic kidney disease, and we can't tease out.
That's right.
I mean, we think this is more and that, but you can't tease those.
Yes, that's a great point. Yeah.
Right. So it's not that unusual. I think
is the group, because cats with chronic kidney disease, that's almost every cat above 10 years.
Yeah.
I'm just exaggerating right now. The group that we're talking about with chronic pancreatitis, can we lump them together in a single group that is testable or researchable? Because that's always the problem with these research
I think you would
studies.
oftentimes have concurrent disease, most specifically inflammatory bowel disease. I do think you can find a population of cats that just has those diseases and doesn't have chronic kidney disease, doesn't have liver. Yes, exactly. But it would take a minute.
The other devil in the details, and you said the word testing, Jolle, is that we actually don't have good tests.
They're certainly not perfect.
Well, I shouldn't say we don't have good tests. If we're looking for some of our research perspective, we don't have an easy way, right, of telling when a patient is in the early stages.
Sure, exactly.
Right? We really can't be.
And that helps with renal disease.
Yeah.
So,
It's much easier with renal disease, right? With pancreatitis, it's harder. And if you think of it from a research point of view, right, if you'd want to get them like early in disease, how are you gonna?
Yeah, absolutely.
How do you make a clean data set?
Well, and you're right, and that's the critical piece that I think in nutrition that we're sort of better understanding. I think GPs are like, yeah, of course, is the idea of preventative care.
Yeah.
Like as specialists, we tend to think more about treating disease and less about disease prevention. But to your point, that really probably is the best way to decrease disease severity, is to treat them as early as possible, maybe even when they're healthy, but they have risk factors for those diseases.
Yeah. Yeah. Or could we even, sort of the holy grail is like, how can you manage a young cat such that it, maybe nutritionally is a good way to look at it, so that they don't go down the pathway.
That's right.
Right. But that's
Other question. You were talking a little bit about the low fat hype, which I think is really interesting, because it is so easy for vets to say, oh, we just do low fat.
And it's entrenched.
And it's entrenched. It's a simple explanation, and simplicity always wins. It's this kind of thing. So can you tell us a little bit, and you may mention the other species, although don't say the D word.
Okay.
We've already done it though.
We're forgiven for that.
As a comparator.
Yeah, because I think that is really interesting, because especially I was just in Japan, and it looks like every canine and cat is put on a low fat diet.
Really?
And I'm so surprised that and I don't really know why.
Yeah.
Wow.
Yeah,
I think it's preventive. Do you think?
I have no idea. I don't think that people know why they do it.
Wow.
So,
interesting.
but
you have to be careful doing stuff like that.
So I want to hear from the expert. What are the risks in putting healthy vets on low fat diets? Do you think that if you have chronic pancreatitis in a cat that you should put them on a low fat diet? I mean, I would just like to hear your thought process there.
Yeah, I mean, honestly, for me at least, when I see a cat that has pancreatitis, fat is not part of my calculus. There has been, I can count on one hand the times with which I felt pretty sure that feeding a very high fat diet caused an acute flare in a cat with pancreatitis. And that's one of hundreds. And we all know that fat is really important. It's an important energy providing macronutrient, right? So it has double the amount of calories as protein and carbs, which is really important for animals that don't want to eat. It provides a really important pelletant for cats. So I think people try to look at good and bad in terms of these nutrients and in nutrition. it's not that. Like, it's a spectrum that you have to decide what's appropriate for the patient in front of me.
And cats are designed for higher.
Absolutely.
Right?
Yes.
And so you would think you wouldn't want to stray too far from their evolutionary imperative, right? Like, we're not going to change their biology.
And if you lower something, right, there's only 3 major macronutrients that provide calories: protein, fat, and carbs. So, like, if you lower fat, then you're giving a higher protein diet, which may or may not come with higher phosphate. You're giving higher carbs, which probably simple starches, which may or may not be the best thing for a kitty cat. So, there's sort of things that you have to think about.
Yeah.
In contrast.
Yeah. Do you have a teaching and research component? I'm sort of
my teaching component is way heavier on teaching during clinics.
Yeah.
So house officers that come and ask questions, students that come and ask questions, less didactic teaching. A lot of the didactic teaching, just kind of the way that our curriculum is structured, is within the subject matter itself. So somebody's talking about chronic kidney disease, for example, and within chronic kidney disease, they will, of course, mention something about diet. But I'm not teaching, it's more disease-based than it is sort of single kind of topic-based or specialty-based, if you will. So more of my teaching is through the clinics, and then kind of outreach, like consulting for veterinarians.
You have this amazing lab in Texas A&M, and York was here, so we talked about that already a little bit. But in your group, there's so many experts there. What is your exact role? I mean, you're the only person that has this double function or double diplomacy. So when do you jump in and say, guys, that's not true?
For me, really, it's more about the nutrition is where I feel that I'm really helping the team. For example, we had a discussion surrounding the role. Am I allowed to say the canine word?
Canine.
Okay.
Yeah, canine is good.
The role of copper in canine hepatopathy, and everyone was kind of talking about diet. But within the diet discussion, they were really talking about the main diet. And it's like, guys, don't forget that, like, in a lot of homes, people are not feeding how they should be, with 90% of calories coming from the main diet, 10% of calories coming from treats and supplements, etc. Right. Many times when I look at a diet history, I see that 40 to 50% of calories are coming actually from the treats. So it's just those little things where you have the clinical experience to say, I've done, thousands of dietary histories. I'm here to tell you that it's probably not just the main diet that's contributing to this condition. And same true as chronic kidney disease, right? Yeah. I mean, Jolle Kirpensteijn, I don't know if you guys talked to her. She's doing some really cool work looking at dietary phosphate that's coming in through various treats for cats, things like churros and other things. Yeah. So I think that's a critical piece. Yeah. So most of my expertise and what I'm providing to the lab, I think, is really from a nutrition eye.
I think that people feed more. Well, there is more treats actually now than there ever were, right? And there's more companies that make them, and there's more supplements than ever. Yeah. And so I think people are. If I just think of, my household, even, you might be stricter than I am with your little canine, but
he only gets one thing.
Yeah.
But he has atopy, so.
So you're.
So but even if I think of my own household, there's more. There's more treats and things, and you fall prey to marketing or my kids like buy treats for the pets, and you tend to forget that we don't tend to evaluate what's in the treats, right? They just tend to sort of be free.
Exactly.
Right. It's free. It's treats. We don't have to care
what's in it. It's showing our love,
right?
So we don't,
and you don't actually like even. I don't do it. I don't like look at the label even.
No, very few treats are completely balanced.
Right.
I mean, that's Julie Churchill's.
Even beyond that, are some of these really popular ones? Do they have a lot of phosphorus in them? I don't even. Yeah. Right.
Yeah.
So
many of them do.
Yeah.
Yes. Especially the really palatable ones for cats.
Totally. It wouldn't surprise me. We're trying to tempt these little sick kitties to eat, and we're loading them with phosphorus.
Yeah. Exactly.
So I really like that you speak up for that, because even in general practice, it's much easier, right? To when you ask a client, they'll say, "Oh, I feed brand X for senior cats."
That's right.
And they won't they won't willingly or proactively tell you about everything else, probably because they don't think you want to know.
Yes. Yeah. And it takes time to do a good dietary history. And in fairness, I think sometimes people just don't have the time. So if you say, what do you feed your cat? And they just say the main diet, then you kind of move on. And unfortunately, it takes more time. You really have to train people to get really good diet information.
We try to collect most of it in advance through this online form.
That's great.
That has lots of spaces, like
so then you can go through and be like, okay, is there anything else?
That's cool. That they have to answer. About treats, they have to answer.
That's fantastic.
My question there is, do you think that people will really give you an honest answer?
So like getting good medical histories and getting good nutrition histories is like a thing that's agitated me for a long time. And when I lecture, sometimes I tell the story that I used to getting a dietary history, like what you feed your cat. And then I'd say, and do you feed any treats? Because I thought, look, there you go. I'm asking about the treats. And I came to a point of realization that the way you ask that question matters, because if I say, Jolle, do you feed treats to your dog? For a good number of people, there's a little thing going in their head, and like it's a yes or no answer, and one is right and one is wrong.
Right. Yeah.
And they'll say no. Right. And it'll be because once a month doesn't count, and it's not really once a month. Or no, I don't give it, but my wife might, but I don't. Do you know what I mean?
That's a good point.
It's a calculation.
Yeah. So how do you rephrase that?
What kind of treats does your cat like? Our cat likes.
Yeah, cool. So like making it relatable.
Making it relatable and making it safe.
Going back to the digital form, I don't think a digital form does that as well. I think that's why you need to have I think for the essential parts of your history taking, there needs to be human involved.
Oh, sure, we go over it in person.
Yeah,
but it allows
it's a good way to have some of the information logged.
Yeah, and it also helped us get around the fact that once a client is in the exam room and you ask them what they feed, they have completely forgotten the name, right? Or you might be asking the person who brought the pet, but not the person who feeds the pet. So that's how we started doing this, right?
Yeah. I'm totally in favor of it. I mean, as you know, I think it's great. I think it's great.
But your point is well taken. You still need to dialogue about it. And you do have to phrase the questions on the form quite carefully. Like, again, what does your cat like?
Right. And we also have to be careful, because I think sometimes, again, veterinarians, because nutrition is sometimes seen as very difficult, very math heavy, is we have to educate veterinarians to understand how to approach treats. Like, it can't be a yes or no situation. We need to help them, because I had a client come to me not that long ago who the veterinarian said, this cat has chronic kidney disease, the cat can't have any treats. And through conversation with the client, it was clearly very important that the client be able to give treats to the cat. That was like part of their human bond. And it was you could just tell from their face, they were very guarded with me. And as soon as I said, well, I think we can find treats that your cat can have. It was just opening up a door for that client. So I think we just have to do a better job. And how do you look at the treats? How do you determine if they are appropriate for the condition that the cat has? So we as nutritionists, we have many things to do, so it's very difficult because there's very few of us. We as veterinary nutritionists, veterinary technicians, veterinary nurses in nutrition need to be able to have those conversations and help educate.
Yeah, you're right that it does open a door that now we need to look at the treats, and now I have to decide.
Exactly, it's more time.
So, but tell me if my approach is wrong. So one way in this world of little time that we have is I encourage cat owners to rotate through a whole bunch of treats, trying to avoid overloading on one kind. Yeah.
I think that's that's nice in terms of cats. We know, like novelty.
Yeah.
They like rotation. So particularly if you have a cat that's part of their quality of life, I think that's great.
Yeah. I try to get the owners to find out like 2 or 3 or however many treats and then rotate them.
And why do you do that?
So they don't get stuck on like one kind of treat, right? And then maybe the cat has kidney disease now and it's already stuck on this one treat that I think.
Trying to help with fixed food preferences and have them be a bit more flexible.
And maybe just things evening out if you're right, if you're using a variety, because they're all going to be different in their nutrients.
And do you do that with kittens too? Do you try to help do you guys try to help
because
promote?
That's where I want to. It's a good question, because that's where I want to go. We know that It's in the kitten phase when they learn to accept certain kinds of foods.
Yeah.
So why would you do it in a later stage in a cat?
Oh, no, I'm not saying I started in a later stage. It doesn't matter the age of the cat, right? I just try to.
It's really smart to think about that as early in life as possible, isn't it? Because trying to get them.
I do have that spiel with kittens. Like,
Yeah.
don't get them stuck on one thing. Like,
That's really smart.
Right.
Do you guys have that as like a form that you give the client? Do you have that as like a client education handout? Because it seems like that would be a great thing.
It would be.
Very smart.
Now I'm going to have to go home and write one.
Yeah, and make it available to other.
I'll send it to you.
Please.
That's a good idea. That's a good idea. Yeah, because I think like I do like most vets, you have this sort of spiel, right, that you give to kitten owners. And you know, one of mine is don't get stuck on one kind of food, right? Even if they say, oh, I can't stand, like some people really like they will gag if they open canned food.
Yeah.
Like, okay, I get that. But don't get stuck on one size or shape.
Right, the shape of the kibble, exactly.
Please, or
yes.
find two foods your cat likes and mix them together. Like, please keep.
Okay, I think while you go there, that's okay, except when you start mixing therapeutic diets. I think that's not a good idea.
We're talking about kittens. So.
Right. Yeah, I think the more forums you learn them early in their lives, the better it is. Yeah. I think that it's not good because I hear also this that people are trying to, I'm just mixing some diets together, which doesn't make any sense.
You know, it's a really good point because you never know how owners are going to interpret what you say, right?
Yeah,
you know, you mean one thing,
yes,
right? And they go home and they say, we're just
true.
Let's add some, whatever to my
everything.
diet.
That's right. My veterinary nurse and I are doing a study looking at feeding tubes in cats and the canine species, and looking at giving them the plan and what actually ends up happening when they come back in for our rechecks.
Right.
And very, like I would say, less than 5% of the time are they actually doing what it says on the plan. So that's right. Like they hear one thing, or and I don't even know that they're trying to be not compliant. It's just that they didn't understand. It's been
things just morph over time too, I think, right? Like you go home with that sheet of paper with all the math on it, right? And especially if it's a longer term feeding tube, by the time you're on like day 7 or day 8, you're like, I don't have to look at the sheet anymore.
Right, I got this.
And it just
morphs. That's right.
And by the way, it's time.
No.
Yes.
We just start talking about feeding tubes and I love them.
Yes. That will be a nice cliffhanger for the next time.
Okay, perfect.
Okay, good.
Because, it's time. So we need to sign off.
And when we talk to Katie in the second episode, we'll start with how do we get owners to accept feeding tubes?
That sounds great.
Right.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.